Hello everyone, welcome back to the channel. Today we are talking about something that worries many parents, baby reflux. If your baby spits up milk after feeding, cries during feeds, arches their back, or seems uncomfortable, this video is for you. The good news is that in most cases, baby reflux is very common and usually improves with time. Let's understand what it is, why it happens, and when parents should worry. What is baby reflux? Baby reflux happens when milk flows back from the baby's stomach into the food pipe and sometimes out through the mouth. This happens because the muscle between the food pipe and the stomach is still immature in young babies. In adults, this muscle closes tightly after food enters the stomach. But in babies, it may open easily, allowing milk to come back up. That is why many babies spit up after feeding. This is especially common in babies younger than 6 months. Is baby reflux normal? Yes. In most babies, reflux is completely normal. Many healthy babies spit up several times a day and still grow normally. Doctors sometimes call these babies happy spitters because they look healthy and comfortable despite the reflux. Reflux usually improves as the baby grows, starts sitting up, and begins eating solid foods. Most babies improve greatly by 12 months of age. Common signs of baby reflux. Now, let's talk about common symptoms. A baby with reflux may have spitting up milk after feeds, wet burps or hiccups, fussiness during or after feeding, arching the back while feeding, coughing, occasionally trouble settling after meals. Sometimes parents think something serious is happening because the baby spits up often. But small spit-ups are usually normal if the baby is feeding well and gaining weight. Why does reflux happen more in babies? There are several reasons. First, babies spend most of their time lying flat. Second, their stomachs are small and fill quickly. Third, the muscle that keeps food inside the stomach is still developing. And finally, babies mostly drink liquids, which can come back up easily. All these factors make reflux common during infancy. Simple things parents can do at home. Now, let's discuss how parents can reduce reflux symptoms. 1. Feed smaller amounts more often. Avoid overfeeding. Smaller and more frequent feeds may help reduce spit-up. 2. Burp the baby during and after feeding. Burping removes swallowed air from the stomach. Try burping halfway through the feed and again after feeding. 3. Keep the baby upright after feeding. Hold the baby upright for about 20 to 30 minutes after feeding. This helps keep milk in the stomach. Avoid active play or bouncing immediately after feeds. 4. Check feeding technique. If bottle feeding, make sure the nipple flow is not too fast. If breastfeeding, ensure proper latching. 5. Avoid tight clothing around the belly. Tight diapers or clothes may put pressure on the stomach and worsen reflux. When reflux may be a problem. Sometimes reflux becomes more serious. A condition called GERD, Gastroesophageal Reflux disease, may happen when reflux causes complications or poor growth. Parents should seek medical attention if the baby has poor weight gain, refusing feed, severe crying with feeds, blood in vomit, green vomit, breathing problems, frequent choking, persistent coughing, fever, or unusual weakness. These symptoms need evaluation by a healthcare professional. Do babies need medicine? Most babies do not need medication. In many cases, reassurance and feeding adjustments are enough. Doctors may prescribe medicine only in certain situations, especially if the baby has pain, feeding problems, or poor growth. Parents should avoid giving medicines without medical advice. Final message. Baby reflux can look scary, especially for first-time parents, but in most cases it is temporary and harmless. Patience, proper feeding techniques, and knowing the warning signs are very important. Always remember, a baby who spits up but feeds well, grows well, and remains active is usually doing just fine.